Good evening and welcome back to GDC classes. So hope you all are doing good. Now as you all know that Target Pharma 360 MCQ series is going on, and we have even solved various questions from um, various different topics. Okay, autonomic nervous system we have completed. We were going on with the autocoids, and this is in this video also we're gonna cover the topic autocoids only. Now histamine, serotonin and all that we have already covered. In this particularly we will be going with the NACIDs. Okay, so without wasting any time, let's start with our first question, that is the given structure is. So they have given the structure of some drug and they are asking that what drug is that, the name of the drug. Now look on to the structure first. Now we have an ether bridge here. One side we have a phenyl and other side again we have a phenyl, that is substituted sulfonamide at one side. Fourth position we have a nitro. Okay. Now the option says nimesulide, phenylbutazone, nefopam and aspirin. So starting with the D, aspirin, the common drug we all know, and its common name also we know, that is the acetyl salicylic acid. So acetyl salicylic acid, it should contain a benzoic acid, and that benzoic acid, it has an acetyl group in its structure. So do we the structure have any of these? No. So aspirin can be removed from the list of options. Then we have nefopam. Now nefopam is another type of NACID. Now its structure is different from others, that it contains an 8-membered ring. Okay, the heterocyclic ring in its structure, and that has two heteroatoms, that is oxygen and nitrogen. So do we have any of these in the structure? I guess no. So C can also be removed. Then B, phenylbutazone. Now name says its structure. So phenylbutazone means phenyl ring, then a butane chain, and one means a ketone group should be there. So we have a phenyl ring, but we do not have a butane chain or the ketone group. So yeah, the B option, it can be removed. So we are left with nimesulide. So yes, the nimesulide is the answer. So this structure belongs to nimesulide. So nimesulide, yes. Then the next question we have, given structure is. So they have again given us the structure and we have to tell that which drug structure is that. So we have a naphthalene ring here which is attached with the methoxy group. That is the structure. Now option says nefopam, nebumentone, celecoxib and metam. Now D option, starting with that, metamizole. Okay, the name says its structure again, azole. Now azole means it should have some cyclic ring that has an heteroatom as nitrogen, that is an azole. Now we don't have any of that in our structure, so metamizole can be removed from the list. Then we have celecoxib. Now celecoxib again is a sulfonamide. Okay, now the structure that is given, that is not a sulfonamide first. Secondly, celecoxib contain a trifluoro group in its structure, so we don't even have that. So celecoxib can be removed from the list again. Then A says nefopam. Now nefopam structure, I just told you. Okay, let me show you also. So this is basically a nefopam structure. Now 8-membered ring we have, and one oxygen and one nitrogen as an heteroatom. So this is the structure of nefopam, and again it is not the structure that is given. So the answer we are left with is nebumentone. So this structure belongs to nebumentone. So these are all the structures that you can see here. Okay, so next the answer is B, that is nebumentone. Now the third question says N-aryl anthranilic acid are a structural analog of. So let's look onto the structure of anthranilic acid first. So this is the structure of anthranilic acid. Okay, so they are asking N-aryl anthranilic acid analog. So one H removed from here and aryl group attached here. So which drug it is? So ibuprofen, indomethacin, naproxen or diclofenac. Let me show you the structures. Anthranilic acid. Now ibuprofen, it has a propanoic acid first thing, and here we have an isopropyl group with a methyl bridge. So no, ibuprofen is not In the options again, as it is not a derivative of anthranilic acid, then we have indomethacin. It contains an indole ring, okay, a methoxy group attached, and then we have an methanoic acid attached to that, indomethacin. So yes, it is not again the anthranilic acid derivative. Then we have naproxen. The naproxen, it can't be, it contains a naphthalene ring in first place, so naproxen is also not there. Yes, the diclofenac, it does contain a benzoic acid, then N attached, then to that N we have a aryl group, and that aryl group is dichlorophenyl group. So diclofenac is the derivative, or we can say the structural analog of this N-aryl anthranilic acid only. Okay. Now the next question says ibuprofen is generally. So they are asking the IUPAC name of the ibuprofen. Now ibuprofen structure I just discussed with you in the last question only. Now it was a propanoic acid. Okay, it contained a propanoic acid in its structure. So if we look onto the options carefully, now A says propanoic acid. So yes, it can be. B says again propanoic. C also says propanoic. D says propanoic. So no, it doesn't contain a propanoic acid. So B can be removed from the list. Then we are left with A, B, and C. So what is the difference in these A, B, C? First difference is this methyl propyl, ethyl, and ethyl. So it's the A says ethyl propyl, and B and C says ethyl propyls. So if I'll show you the structure, so it contains 1, 2, 1, 2, 3 propanoic acid. Okay, now other side we have a methyl, and then we have a propyl group. So the ibuprofen contains a methyl propyl. Okay, so A option says methyl, B and C says ethyl. So B and C can be removed from the list. So A will be the answer. That is the methyl propyl phenyl group propanoic acid. Okay. Now the next question we have, 2-acetoxy-benzoic acid is aspirin, nefopim, metamizole, or Vefecox. Now it is a very simple question. Okay, and the drug we have already discussed also. Now aspirin we can also call this acetyl salicylic acid, or we can also say 2-acetoxy-benzoic acid. That those are the same things. We have a benzoic acid and then an acetoxy group is attached there. So that is the structure of aspirin. So here benzoic acid with second position acetoxy group. That is the 2-acetoxy-benzoic acid or aspirin, or we can also say it the acetyl salicylic acid. Okay. Now next, ketoprofen is chemically. Now they have again asked from the question from the IUPAC name only. So they are asking the IUPAC name of ketoprofen. Now, ibuprofen, ketoprofen, almost similar structure with just small structural differences. So it also contains a propanoic acid in its structure. So propanoic acid. So all four says propanoic acid. So we can't remove any based on that. Then it says 1 benzoyl phenyl, 4 benzoyl phenyl, 3 benzoyl phenyl, and 3 benzoyl phenyl. So let me show you the structure. Now it says 1, 2, 3. So at second position this phenyl group is attached. Then this is the benzoyl ring. So 1, 2, 3. So at third position we have our benzoyl group attached. Okay, now let's look on to the options. So at third position, so A and B says 1 and 4, so they can be removed from the list. C and D says 3 benzoyl, 3 benzoyl. Sorry, yes, at third position the benzoyl group is there. So C and D, we can consider one of them will be the answer. Okay, so now the C says at fourth position of propanoic acid, the 3 benzoyl phenyl group is attached, and D says at second of the propanoic acid. Okay, now propanoic acid is a 3 carbon chain. Okay, now it can't have 4. It is not even possible that it has 4 carbon, but still I'll show you the options. So 1, 2, 3. So at second we have this group attached, the second position. So the answer is the D one, that is the 2,3 benzoyl phenyl propanoic acid. Now the next we have following acid is propanoic acid. Now again the same question, okay, which drug has a propanoic acid in its structure? So ibuprofen, indomethacin, metamizole and diclofenac. So this is a very obvious question. We have already discussed this many times. Ibuprofen and ketoprofen, these are two drugs that have propanoic acid in its structure, okay. So yes, ibuprofen, ketoprofen is not in the options. Ibuprofen will be the answer. Let me show you the uh, structures of all the drugs so that you can relate. So here ibuprofen, we have a propanoic acid 1, 2, 3, okay. Then we have indomethacin, we have an indole ring with a methanoic acid, again methanoic, not a propanoic. Then diclofenac, again we have a methanoic acid. Then in metamizole we don't even have an acid group attached, so the answer will be ibuprofen. So A. Now the next question, in the given structure of allopurinol, X will be. So they are saying allopurinol and they are asking the X. So this is the structure of allopurinol, but what is the X here? So allopurinol, the name says its structure, or the answer is in question only. So allopurinol, nol group, all means alcohol group, that is it should contain an OH group. Okay, now here we don't have any OH attached, so double bond X. So if we look onto the options carefully, we have F, OCH3, C, that says O, and CN. So if we attach here O in the place of X, then it also forms an OH. Now if we will remove this double bond and if we will go on with single, then it will be OH. Okay, so the option will be the C one. Okay, the allopurinol, it contains an O here, so double bond O, or we can say single bond OH. These are the same things. So allopurinol, this is the structure. Again here it is an anti-gout agent. Okay, so whenever the uric acid concentration in our body it increases, that leads to a gout. So there this allopurinol is used, that is the anti-gout agent. It decreases the uric acid level, okay, in our body. So C is the right one. Then next we have allopurinol undergoes metabolism where it transforms into. So they are asking the question from the metabolic reaction of this allopurinol and what particular drug it forms after its metabolism. Let us see the metabolic reaction. So allopurinol, it is metabolized in the presence of aldehyde oxide or oxidase or the xanthine oxidoreductase to oxypurinol. Okay, so oxypurinol is the drug that is the metabolic product of this allopurinol. So the answer is the oxypurinol. Now the next question we have, febuxostate generally contain dash ring. So they are asking that particular drug, which ring is present in its structure. Is it a thiazole, imidazole, pyrazole or pyridazine? Now this here is the structure of the drug. So it is a xanthine oxidase inhibitor. So here we have a phenyl ring attached, and next ring we have a thia group and we have an azole group. So thiazine we can say it. So thiazine ring we have here. So the options, if we look on, so yes, it has a thiazole. So A will be the answer, that it contains a thiazole ring in its structure. Now next we have oxyfen butazone is generally a derivative of. So they are asking the derivative oxyfen butazone. So let's look on to the options first. Pyrazolidine 1,2-dione, pyrazolidine 2,5-dione, pyrazolidine 2,4-dione and pyrazolidine 3,5-dione. So they are basically asking the position of this one in the pyrazolidine. Okay, they are asking the position of the ketone groups, the ketone group. So let me show you the structure first. So this is the oxyfen butazone and this here is the pyrazolidine. So let's number 1, 2, 3, 4, 5. So at third and fifth position we have the diones. So the D option is correct. That is at 3 and 5 position we have the diones. That is the pyrazolidine. Okay. Now the 14th question again, the Sulindac is generally dash derivative. Sulindac is the drug, okay, and they are asking that what particular derivative is that? Is it an indole acetic acid, indene acetic acid, xanthine or xanthin? So let's look onto the structure first. So this is the structure of Sulindac, and here we have a phenyl ring plus we have a fused ring, and this fused ring is called as indene. Okay, so this is the indene ring, and acetic acid is attached to the indene ring. So it is basically a class of NACID. Okay, it belongs to the class of NACID, and it has an indene ring plus a benzene ring or phenyl ring in its structure. So second option, the indene acetic acid is the derivative. Indene acetic acid derivative is the Sulindac. Okay, now the next we have the question, dash a metabolite product of sulfasalazine is used in rheumatic arthritis. Now they are asking about the metabolic product of sulfasalazine. Now sulfasalazine, now let's look onto the options first. A is the 5-amino salicylic acid, B is sulfapyridine, D is both A and B, and D is the sulfapyrazine. Now sulfasalazine has two metabolic products, that is 5-amino salicylic acid and sulfapyridine. Now here don't get confused by saying that C is the option, that is A and B, as they have already said that the metabolite that is used in rheumatic arthritis, okay, the rare disease, okay, that the autoimmune rare disease, the rheumatic arthritis, you all know, I guess you would have known, heard about the rheumatic arthritis. It is a rare autoimmune disease. Okay, so basically both A and B are the metabolic product, but for the rheumatic arthritis, the B, that is the sulfapyridine, is used. Okay, so the answer is here, the two metabolic product, but sulfapyridine is used in the rheumatic arthritis. Okay, so the B is the answer. Now the next question we have, in the given structure of naproxen X is, again they have given the structure of naproxen and they are asking about the X. So naproxen structure also we have discussed before. So it does contain a naphthalene ring and then we have a chain here attached. So with that naphthalene ring, what group it was there? Is what it is an methoxy group, or we can say an OC6H5 group, then we have CH3, then we have chloro. So I guess the A option is right, as it contains a methoxy group. The naproxen, naphthalene ring with a methoxy group at one side, and the other side we have a chain, a carbon chain. So it is the OCH3 group. Okay, it is also a NACID. So A option is the correct one. The next we have identify the given structure. So they have again given the structure. So we have to find that what particular structure is it. So this we have a phenyl ring in between, and then we have a COOH group. Again we have a sulfonamide that is attached to the ring, a long carbon ring. Okay, chain, we can say, not a ring, sorry, a chain, carbon chain, a long carbon chain is attached. So it says proben acid, then pyrazinamide, sulfapyrazone or febuxostate. Now febuxostate, we just discussed its structure. Okay, I guess you remember it contains a thiazole ring. We just discussed its structure. The ring question was asked from it. So here we do not have that thiazole ring again. So yes, febuxostate, it is removed from the option. Then we have a sulfenpyrazone. So C option says pyrazone ring. So do we have a pyrazone ring here? No, I guess. So C option can also be removed from the options again. Then B says pyrazinamide. Now amide, it does contain a sulfonamide, but it do not contain any pyrazine ring. Okay, so pyrazinamide, again it can be removed from the list. So B is removed from the list. So the structure belongs to, we are left with only the probenecid. So the structure belongs to probenecid. So yes, this is the structure of probenecid. Here you can see we have a sulfonamide group attached with the long carbon chain, and here at this side we have a ring attached, and here we have a carboxylic acid. Then pyrazinamide, again we have an amide group here and a pyrazine ring. Then sulfenpyrazone, again a pyrazone ring we have. Then phoboxate, I told you thiazole ring is there in its structure. We just discussed its structure. So yes, the answer is the probenecid. Now the next question we have, naproxen is generally metabolized into. So they are asking again the metabolic product of naproxen. So let me show you the uh, reactions of the metabolic reactions of naproxen. So naproxen here, it is metabolized in the presence of cytochrome P450. It is the most abundant enzyme that is present in liver, okay, responsible for the metabolism. Monooxygenase, cytochrome P450 monooxygenase. So it naproxen is metabolized to 6-O-desmethyl naproxen. This is the metabolic product of naproxen. So if you look onto the option, yes, the D one is the right. That is the 6-O-desmethyl naproxen. That is the metabolic product of naproxen. Now the next question says, drug which is present, which is used to increase the metabolism of the uric acid. So basically they are asking, so these are all the anti-gout drug, and they are asking that out of which of these drugs which increases the metabolism of the uric acid. So pegloticase, okay, pegloticase is the drug that is responsible for increasing the metabolism of the uric acid. Yeah, the A option is the right. That is the pegloticase. Okay. Now the next question we have here, the chemical synthesis of aspirin from salicylic acid involves the use of which agent to introduce the acetyl group? So, as we already know, aspirin, the another name is acetyl salicylic acid, okay, or 2-acetoxybenzoic acid. All these three are the names for the aspirin. Now they are saying that with salicylic acid, what other reagent is involved that result in the formation of the aspirin? So A option says acetic acid, B says acetic anhydride, C says ethanol, D says methanol. So basically this is the reaction. So salicylic acid, when it is in the combination with the acetic acid, it forms the acetyl salicylic acid, and then acetic acid is removed. Okay, so the second reagent that we use along with salicylic acid is acetic anhydride. So B is the answer. That is the acetic anhydride that we use with salicylic acid to form aspirin. Okay, so this is the answer. Now this was the last question for this particular series of MCQs. Okay, hope you understood all the questions and the concept behind them. So if you have any difficulty in any of the questions, you can ask me in the comment section. So thank you for watching the video. Thank you so much.